So my name is Nikita Machado and I'm an endocrine surgeon. I've been with Northeast Georgia Medical Center for about 9 months now. So as an endocrine surgeon, I deal primarily with the thyroid, the parathyroid, and the adrenal glands, both benign and malignant disease, any of which can be treated operatively. So why did I choose medicine? A number of reasons. The most important thing I think is it's hard to find a profession where you can work with your hands and benefit so many people at the same time. It's technically challenging, it's intellectually stimulating, and then when patients do well, that's sort of like the biggest gift you could have in your career. And so put all those things together and I guess you have an endocrine surgeon. So a lot of times I get asked the question, why an endocrine surgeon? And I think it's interesting because we are a newer specialty. We've only really gained traction over the last few decades. And there's maybe 200 endocrine surgeons in the entire country and probably another 100 globally. And what sets us apart, I think, is that we've focused our entire professional career on thyroid, parathyroid, and adrenal disease. So we deal with benign and malignant disease day in, day out, 3-4 times a week. And the more you do something, the more comfortable you get at it and the better your outcomes are. It also means that we stay on top of cutting edge research when it comes to thyroid, parathyroid, and adrenal disease. We work extremely well with our multidisciplinary groups, and we do our best to get patients the absolute best outcomes that we can. I think it's important to realize that patients can go anywhere for their care, and most patients, I think, want two things. They want to get the best care that they can, and they want to feel like they're going somewhere close to home. And I think Northeast Georgia allows us to do both those things. We have physicians, surgeons, providers who love what they do and care deeply about their patients. And then it's convenient because you're not trying to drive into a large major city fighting traffic. You get to get taken care of in your own home. And I think finding a place that does both those things for you can be optimal if you can get it. So when I'm not here at work, which is easier now as an attending than it was as a resident, my husband and I love to do escape rooms together. It's a little bit of a quirky, niche, fun thing, and we've done maybe 150, 160 so far. We also love to travel, so weekends that we are free, you'll see us getting in the car and hopefully leaving the state to go see new things. We're still exploring Georgia because we haven't been here that long, and so we found some amazing places to go, especially with our 2 dogs because they love hitting the road just like we do.